Good afternoon. My name is Alexis Melander, and I am here to talk to you about newborn screening. I am a current nursing student at the University of South Alabama, and newborn screening is so important to many nurses because it is what stands between having time to make those life-altering decisions and being able to properly prepare a family for having to make those life-altering decisions. Newborn screening is a group of varying tests performed shortly after birth. These tests can consist of blood tests, a hearing test, or a screening for congenital heart defects. These tests are used to determine the presence of genetic, metabolic, and developmental disorders, and these changes can seriously affect the child's quality of life as well as their lifespan. Public Law 110-204, also known as the Newborn Screening Saves Lives Act of 2007, was a law that was put into place to help fund grants to further research into newborn screening. It helped to further education for laboratory staff as well as nursing staff, not only on the importance of newborn screening, but also on the importance of communication and communication techniques, as well as getting the proper information out on newborn screening on a level in which the general public can understand. Public Law 110-04 is part of the reason why, as of 2011, every state has a requirement to do newborn screening. And although this is a federal law, there are times when there have been grants for religious exemptions, but also there are an abounding presence as well as evidence that this newborn screening or getting your child tested as early as possible for these different genetic defects can give the medical personnel the time that they need to make those life-changing and life-saving decisions. Public Law 110-204, which was effectively signed in 2008, also funded resources for treatment as well as counseling for post newborn screening. As of right now, that very law is up for revision. It is listed under H.R. 482, Newborn Screening Saves Lives Reauthorization Act of 2021, sponsored by Democratic Representative Lucille Roybal. This act in particular amends the Newborn Screening Saves Lives Act of 2007 to further embellish upon the funding to further research and further health services, as well as proper training and communication and resources to even further develop newborn screening. Like I said, as of 2011, we're screening for over 40 diseases at the start of birth. And with this new policy that is currently pending presentation to the Senate, it will even further that research to add on new diseases and new information that we have to what is already a uniform panel across the states. Newborn screening is so important because in the time that child is born or that child is conceived, we can see and understand and know what to expect once that child has come into the world, and give every child the chance to live their best life. These policies also dedicate funding to counseling, which is something that is very important to those parents who unfortunately know the pain of infant death. Newborn screening helps to make the infant death not a waste. Thank you for your time.